This question is for Nicole or Doctor. Just in regards to the vaccine program launching today, your message to the community.
So with the vaccination verification program, Rob, launching today, I think probably my message is more, well, I guess to the community, but also the businesses, just to, be patient. I know there's a lot of pieces that need to be put in place. And with any big change that we've seen under the ROA, our businesses in particular, those that are implementing the vaccination verification, it is a big change. And so it'll just to be patient with everyone. For those businesses that are implementing, we are here to support them. So if they have questions, certainly, please give us a call. And we're always happy to have our team go out into the community. We will be out there on a proactive basis. And really for the next few weeks, it'll be to support our businesses in our community and moving in sort of this monumental step. As well, folks that just have questions, Q&A, we know the province has information available and they have a line. We're also here as well. So certainly, if there's questions or concern, lack of clarity, we are here to support the community, to move forward.
Nicole, I know a couple of weeks ago, yourself and Dr. Ahmed said zero tolerance. With this program launching today, and for example, if a business is not following it, will they be educated, or is it still zero tolerance?
So the zero tolerance that was discussed is relative to, sort of requirements that have been in place for quite some time, and there's been considerable education around them. With any new change or new requirement, we always strive for education first. So that's always our first step. So again, as I said, we will be doing an enforcement split actually coming up this week with our provincial partners. We've done that in the past. And so they'll be looking for, compliance related to the Reopening Ontario Act, and certainly the vaccination verification will be, certification will be one of those compliance that they'll be looking for. And in that regard, it'll be, education first. I understand that it is, up to the business to figure out how they're going to implement all this. And so first is to educate, help them through it. And we always do that before we move to enforcement.
And one final question, Nicole, just in regards to, I guess, your staff. I know they go out there and we all see how, I guess, customers are maybe taking it out on staff of an establishment. But when your staff is out there, are they getting some backlash as well? I'm guessing it takes a toll on your staff as well.
Yeah, I think when my message is be patient, that includes our own staff. So I think they are out in the community and they have definitely taken some backlash for doing their jobs, and it is not an easy job it's not an easy job. Our enforcement officers are out there and often alone, and so I guess I would just ask for a little kindness and patience, and certainly towards those individuals, whether it's the business or our own officers who are there to protect the community, and they're doing their job.
Thank you.
Any questions from CTV?
Yes, good morning. What is the penalty for not complying with the vaccine passport for individuals or businesses?
So I believe it is $750 for a ticket under the ROA, and that's for an individual, and then $1,000 for a corporation, and that's for each failure to comply.
Okay. And just talking more about schools, I know it's something that you've talked about a lot since the beginning of September, but how do you think the management of the COVID cases in schools is going at this point?
Dr. Nazarthari, do you want to start?
Sure. So I think that we work collaboratively with the school district and the school board, and we have regular dialogue with the school officials to try to manage the individual cases, manage the cohorts that might be exposed, and to make public health management plans that effectuate containment, and also do our very best to keep schools open. It's a balancing act between many competing priorities. but I think that the school board has and school board officials have done a lot to effectuate good public health management plans.
Okay, and there's been more talk and studies on the possibility of Pfizer vaccine for 5 to 11-year-olds. What is your position on this?
Well, the regulation of vaccine eligibility is a federal matter, and I would ask that you ask the federal officials to comment on that. As a generic construct, the more people we can vaccinate safely, the better. So, but I would ask federal officials and to comment on where that might be related to the regulatory process.
Okay, thank you.
Any questions from CBC?
Hi there. I realize that you've spoken about the penalty for non-compliance, but I'm just wondering if you can clarify at what point will police become involved, and will there also be city bylaw officers involved with enforcement?
So all provincial offences officers can enforce the rules and regulations under the Reopening Ontario Act. So that includes, for us, our public health inspectors, as well as our tobacco and vaping enforcement officers. Bylaw and police are all also provincial offences officers and have the ability to enforce the ROA. We do work very collaboratively with all our enforcement partners locally. We meet regularly to discuss the ROA and changes and talk about enforcement plans to ensure that we're all on the same page. So, as it relates to vaccination verification, I, would expect certainly we will do our part by law as well, and be working with our enforcement officers, including police, where needed.
Okay, great. I just have one more question. This goes back to schools, but if case rates start to lower in Windsor, Essex, are you, and with October 1st approaching, are you looking to change the recommendation for school boards to go ahead with the extracurricular activities?
So our recommendation for extracurricular was to delay until at least October, just to monitor the situation and see how, give an opportunity for students to get into the classroom and learn, as well recognizing that schools have been closed for quite some time. So for schools, it is quite an undertaking to bring students back and make sure that they're able to move around the school safely and be in the classroom, which is the priority. As far as our recommendations, we're, as Dr. Nisbet said, we're meeting with the school boards regularly, and so those will be part of our ongoing discussion.
Okay, great.
Yeah,
Thank you.
If I could just supplement that as well. Nicole can give you the exact number, but I believe that we've dismissed 65 cohorts of young people since the beginning of this wave. Is that right, Nicole?
Yeah, approximately 65 cohorts.
So when we think of burden of illness or burden of COVID to school districts, that's a very significant number of young people. Whenever one looks at the burden of illness or burden of COVID, you have to look at just not the number of cases, but the number of people self-isolated, and for schools, the number of cohorts. The second issue is that we're trying to work collectively with the school district and the school board and school officials is containment. So first and foremost, reduce the number of cases of COVID in the community overall. And number two, if COVID does somehow make it in its way into the school, to make sure it doesn't spread throughout the school. The more human-to-human interaction there is in a school, the more likely it's likely to spread if there is in fact a COVID introduction into a particular school. Recognizing that also extracurricular activities sometimes involve 2 and 3 schools, it could lead to even more challenges with containment as an approach. So it's definitely a complicated strategy to try to manage COVID in schools, but I think we'd have to look at a variety of factors, and the number of cases in the community would just be one factor. The second item, and I think it's important to consider this, is that how we manage an introduction or in a school in part depends on the number of people vaccinated in the school. If you're vaccinated, you're less likely to get infected. If you're vaccinated, you're less likely to get seriously ill from COVID-19. And on a population health level, the higher the vaccination rate, the less likely there's to be spread throughout the institution. Our best estimate is that perhaps in high school students, people between the ages of 13 and 18, perhaps approximately 1/2 of those people are currently vaccinated. So, to capsulize this, the number one thing that people can do to help with the reduction of COVID transmission in schools is to get their children vaccinated if they're eligible for vaccine. In Windsor, Essex, I think the vaccination rate for other disease states is approximately 88%. It's close to 90%. And our vaccination rate for young people for COVID is approximately 50%. So that gulf is pretty significant. And I would ask every parent and every young person who's eligible for vaccination, if we want to contribute to trying to keep schools open, to get vaccinated and get that vaccination rate up to the level that we would have for other disease states. And it's not impossible for sure. So anyway, in a nutshell, I think those are the priorities if we want to try to keep schools open. Forgive me for being long-winded, colleagues.
Thank you.
Any questions from Blackburn?
Asked and answered. Thank you.
Any questions from the Windsor Star?
Yes, good morning, Nicole, and good morning, Doctor. I'm just wondering if the outbreaks on area farms are still relatively small and well contained as they were when we had the last update.
And maybe, Nicole, you can answer and I'll supplement that with a more general sense too.
Sure. Yeah, thanks for the question, Taylor. Yeah, the outbreaks that we have at the moment are, and comparatively to what we experienced, and everyone would certainly remember what we experienced in 2020, the outbreaks that we're seeing right now are fairly contained at this time. So, and Dr. Necessary will, I'm sure, add.
Yeah, from my vantage point, the migrant farm worker community and people is at particularly high risk for the consequences of COVID-19, especially the unvaccinated population of migrant farm workers. We remain concerned, in the context of the fact that there were deaths of migrant farm workers and many significant outbreaks throughout the province. We remain concerned and vigilant to try to effectuate containment as best as possible and try to work with farm operators to engage in practices that are less likely to result in large-scale outbreaks. We remain concerned about the availability of self-isolation residences for members of the migrant farm worker community, and that is a priority of the health district to make sure that if someone is exposed or someone is infected with COVID-19, that they have the opportunity to self-isolate in an environment that's conducive for them to recover. Or as well as prevent transmission to other people.
Thank you.
Any additional questions from AM 800?
Doctor, just a quick one for you. Back in August, obviously, when Dr. Ahmed announced his resignation. So you've been with us about, I believe, 3-4 weeks now. Any surprises, anything catching you off guard for Windsor, Essex, and I guess how we're handling COVID, anything like that?
Well, as a doctor, we don't like surprises. So, but I think the one observation I would say is the Windsor Essex Public Health team and the people who support the team, from the nurses, public health inspectors, epidemiology staff, and others. They've been excellent at effectuating the plan. So, as someone who's new to the health district, I think that Windsor Essex has got an excellent professional staff at the Public Health Service. Secondly, I think the one core message I would try to share is we all have a role in managing COVID-19. The Public Health Service can guide and provide professional expertise and help with strategic and policy matters. But the fact of the matter is, right now in the COVID pandemic, it's not really the public health service who's really going to effectuate the effort in its entirety. It's going to be every citizen. So every business owner who effectuates vaccine verification, every family member or every parent who gets their child vaccinated, every parent and guardian who screens their children and keeps them at home, every person who doesn't leave the house if they have respiratory symptoms. I think it's that collective effort that's going to make the difference. But I do think the Public Health Service in Windsor, Essex is doing a good job in trying to manage the pandemic.
Thank you. Have a good day.
Thanks.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thanks.
Any additional questions from Blackburn?
All good, thank you.
Any additional questions from the Windsor Star?
Yes, just one. Is Windsor Essex throwing away vaccines?
Are you talking about like vaccine wastage?
Yes, because we know the demand has dropped significantly. I'm just wondering if we are at a point where they are expiring and we're having to dispose of vaccines that aren't being used.
So I don't, and so I'll just clarify that we don't manage all the vaccine that's in the community. I have to discuss what our vaccine wastage is, but within any vaccine program, there's always some wastage, but we always do our best to ensure that there's absolutely none, and that includes sharing with other districts or with Windsor Essex to ensure that anything that's close to expiry, the expiry would be used before that would happen.
So I know earlier on when demand was quite high, you were expecting very large shipments from the province. So as demand has dropped off, has the shipments just become sort of like on a as needed basis, smaller?
Yeah, absolutely. We shifted to more of a pull model. So we ask for what we believe we need. And so what we're receiving is much lower, and on the basis of what we have and what we believe we will need.
Okay, thank you.
Thank you, everyone. Have yourselves a great day.
All right. All the best.